Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Gout versus the pseudo gout. Now let's talk about just gout. So what is the crystal composition of gout? So the crystal composition is the monosodium urate. Next is what is the shape of this gout? The shape is it is needle-like. So it is needle-like. Then what is the pattern? Bifringence pattern. It is negative bifringence pattern, and the most commonly affected joint being the MTP. So the first MTP is the most commonly involved joint. Then talking about the X-ray findings of the gout, it is the periarticular erosions with the overhanging margins. So it is the periarticular erosions with the overhanging margins. They are overhanging margins. Next, what we are going to look at is the pseudo gout. So in terms of the pseudo gout, the crystal composition, it involves a calcium pyrophosphate, whereas in gout it was a monosodium urate, whereas in pseudo gout is going to be the CAP, that is a calcium pyrophosphate. Next, we look at the shape. So in terms of the shape, what is involved? So in terms of the shape, it is rhomboid. So under rhomboid is what is present in the pseudo gout. Next is the bifringence pattern. So bifringence pattern, it is weakly positive. It is weakly positive. Next is the most commonly affected joint. So the most commonly affected joint in the pseudo gout will be the knee is involved. Then what is the X-ray findings? If you look at X-ray, it is the chondrocalcinosis which is seen. So pseudo joint means it involves the knee. The gout means it involves the first metatarsophalangeal joint. To learn and grow daily like this, please do subscribe.